Phenytoin, a medication primarily known for its anticonvulsant properties, has long been an ally in managing epilepsy and seizures. However, there is a hidden versatility to this drug that many are not aware of. From treating cardiac arrhythmia to relieving neuropathic pain, phenytoin's wide-ranging applications are slowly coming to light. In recent years, researchers have been investigating the potential benefits of phenytoin beyond its traditional use. Studies suggest that it may have anti-inflammatory properties and could help in managing autoimmune disorders such as rheumatoid arthritis. Additionally, phenytoin has shown promise in promoting wound healing, making it a valuable asset in dermatology and wound care. As we dive deeper, we will explore the lesser-known applications of phenytoin and discuss the evidence supporting its use in these areas. From cardiac health to pain management, the potential benefits of this medication are far-reaching. Join us on a journey to uncover the hidden benefits of phenytoin and discover the untapped potential of this remarkable drug. The history of phenytoin. Phenytoin, also known by its brand name Dilantin, was first synthesized in 1908 by the German chemist Heinrich Biltz. Initially, it was developed as an antipyretic, or fever-reducing, medication. However, its anticonvulsant properties were soon discovered, leading to its widespread use in the treatment of epilepsy. The discovery of phenytoin's anticonvulsant effects revolutionized the management of epilepsy. Prior to its introduction, the options for controlling seizures were limited and often ineffective. Phenytoin provided a breakthrough, offering improved seizure control and a better quality of life for individuals living with epilepsy. Phenytoin in the treatment of epilepsy. Phenytoin has been a mainstay in the treatment of epilepsy for decades. It works by stabilizing the electrical activity in the brain, preventing the excessive and abnormal firing of neurons that leads to seizures. The drug is particularly effective in controlling partial seizures, which originate from a specific area of the brain. While phenytoin is highly effective in managing epilepsy, it is not without its drawbacks. The drug can have significant side effects, including drowsiness, dizziness, and coordination difficulties. Additionally, long-term use of phenytoin may lead to the development of gingival hyperplasia, a condition characterized by overgrowth of the gum tissue. Phenytoin is an antiarrhythmic drug. In addition to its anticonvulsant properties, phenytoin has been found to have antiarrhythmic effects. Cardiac arrhythmia, or irregular heartbeat, is a common condition that can have serious consequences if left untreated. Phenytoin works by blocking the sodium channels in the cardiac cells, preventing the abnormal electrical signals that cause arrhythmias. Studies have shown that phenytoin can be particularly effective in managing ventricular arrhythmias, which occur in the lower chambers of the heart. It has been used successfully in emergency situations to restore normal heart rhythm and prevent life-threatening complications. However, it is important to note that phenytoin should only be used under the guidance of a healthcare professional for the treatment of cardiac arrhythmias. Phenytoin for neuropathic pain management. Neuropathic pain is a chronic pain condition caused by damage to the nerves. It can be debilitating and significantly impact a person's quality of life. While there are various medications available for managing neuropathic pain, phenytoin has emerged as a potential treatment option. The exact mechanism by which phenytoin relieves neuropathic pain is not fully understood. However, it is believed to involve the modulation of voltage-gated sodium channels in the nerves, reducing the abnormal firing of pain signals. Research has shown that phenytoin can be effective in managing various types of neuropathic pain, including diabetic neuropathy and postherpetic neuralgia. Uncovering the hidden benefits of phenytoin. Beyond its well-known applications in epilepsy, cardiac arrhythmia, and neuropathic pain management, phenytoin has shown promise in several other areas of medicine. Researchers have been exploring its potential use in managing autoimmune disorders such as rheumatoid arthritis. Autoimmune disorders occur when the immune system mistakenly attacks the body's own tissues, leading to chronic inflammation and tissue damage. Phenytoin has been found to possess anti-inflammatory properties, which may help in reducing the inflammation associated with autoimmune conditions. Preliminary studies have shown promising results, but more research is needed to fully understand the potential benefits of phenytoin in this context. Additionally, phenytoin has been found to promote wound healing. Wound healing is a complex process that involves various cellular and molecular mechanisms. Phenytoin has been shown to enhance the formation of granulation tissue, which is crucial for the healing of wounds. It also has antimicrobial properties, helping to prevent infections and promote a faster recovery. Potential side effects and precautions of phenytoin. As with any medication, phenytoin is not without its potential side effects and precautions. Common side effects include drowsiness, dizziness, and coordination difficulties. These side effects can be more pronounced in the elderly or individuals with liver or kidney problems. It is important to take phenytoin as prescribed and avoid activities that require alertness until you know how the medication affects you. Long-term use of phenytoin may lead to the development of gingival hyperplasia, a condition characterized by overgrowth of the gum tissue. Regular dental checkups and good oral hygiene practices are essential for minimizing the risk of this side effect. Phenytoin can also interact with other medications, including oral contraceptives, blood thinners, and certain antibiotics. It is important to inform your healthcare provider about all the medications you are taking to avoid potentially harmful interactions. How to take phenytoin safely. To ensure the safe and effective use of phenytoin, it is important to follow the prescribed dosage and instructions provided by your healthcare provider. Phenytoin is typically taken orally, either as immediate release capsules or as an extended release formulation. It is recommended to take phenytoin with or after a meal to minimize the risk of stomach upset. Avoid crushing or chewing the capsules, as this can affect the release of the medication. If you are switching from one brand of phenytoin to another, it is important to inform your healthcare provider, as different formulations may have different bioavailability. Regular monitoring of blood levels may be necessary to ensure that the phenytoin levels remain within the therapeutic range. Your healthcare provider will determine the appropriate dosing and monitoring schedule based on your individual needs. Conclusion: the versatile applications of phenytoin. Phenytoin, a medication primarily known for its anticonvulsant properties, has proven to be a versatile drug with a wide range of applications. From managing epilepsy and cardiac arrhythmia to relieving neuropathic pain and promoting wound healing, phenytoin continues to surprise researchers with its untapped potential. While the use of phenytoin in these areas shows promise, further research is needed to fully understand its mechanisms of action and optimize its therapeutic benefits. As with any medication, it is important to consult with a healthcare professional before starting or changing any treatment regimen involving phenytoin. As we continue to uncover the hidden benefits of phenytoin, it is clear that this remarkable drug has much more to offer than initially meets the eye. Its versatility and potential applications make it an invaluable asset in various fields of medicine. Thanks for watching.